Assalamu alaikum. My name is Myra Tariq. My roll number is BP1650119 and my topic is anti-cancer drug Dacarbazine. Dacarbazine is an anti-cancer drug. It is an anti-neoplastic drug. It is a synthetic compound that functions as an alkylating agent. It must undergo biotransmission to an active metabolite called methyl triazone imidazole carboxamide. MTIC is responsible for the drug's activity as an alkylating agent by forming methyl carbonium ions that can attack the nucleophilic group in the DNA molecules. The cytotoxic activity of dacarbazine has been attributed to the ability of its metabolites to methylate DNA at 6th position of guanine. It kills cell in any phase of cell cycle. Dacarbazine therapy has been associated with serum enzyme evaluation during therapy and occasional cases of severe and distinctive acute hepatic failure, probably caused by acute sinusoidal obstruction syndrome. Main indications: dacarbazine is primarily indicated in conditions like Hodgkin's disease, malignant melanoma, neuroendocrine tumors, soft tissue carcinoma. Off-label uses include thyroid cancer and neuroblastoma. Contraindication: hypersensitivity, severe myelosuppression, which could be caused due to leukopenia and thrombocytopenia, severe hepatic or renal impairment, and especially during pregnancy and lactation. It is a contraindicated drug. Mechanism of action: majorly act as an alkylating agent. It may act as a purine analog, an antimetabolite, but exact mechanism of action of dacarbazine has been unclear. Dose adjustment: dacarbazine doses are adjusted for adults, pediatrics, and geriatrics. For adults, it acts during Hodgkin's lymphoma and metastatic malignant lymphoma, both acting as an ABVD protocol drug. During pediatrics, we use it in Hodgkin's lymphoma and neuroblastoma therapy, which is off-label use during the pediatrics. Now geriatrically, it is used in the Hodgkin's lymphoma and metastatic malignant lymphoma. The use could be repeated every 15 days. In all these cases, the warning is that it has been warned that it is classified as a pregnancy category C and not recommended for use in pregnancy or lactation, and it is not recommended for neonates. Brands: there is a chart which shows the brands and their prices, and the alternate brands and their prices which give the same drug at a lower prices. For example, dacarbazine by Umair Associates, which is cost up to $659, can be alternated by citrotrexate by Lahore Chemicals and Pharmaceutical Works, which is priced at 505 rupees or 161 rupees according to their two doses, which is 2.5 mg and 110 mg. Similarly, dacarbazine by Pharmadec PVT is costed for 500 rupees, and C-Ciprol, which is by Pfizer Laboratories, is a cisplatin alternate brand for dacarbazine therapy, which is costed up to 200 and 960 rupees according to 100 mg per ml or 50 mg per ml. Ductin, which is 540 rupees, can be replaced by blastolim. Sharper Pharmaceuticals produces this drug at cost of 700 rupees for 50 mg per ml and 200 rupees for 10 mg per ml. DAC, which is been produced by medicine pharmaceutical, costs up to 500 rupees, can be replaced by alkymes, which is 499 rupees, or adox, which costs up to 390 rupees. Side effects: Dacarbazine is used in the regimen for Hodgkin's lymphoma. It causes nausea in 90% of patients and vomiting in almost 90% or more than 90% of patients. Injection site pain: these develop for up to 1 to 3 hours after treatment and may last up to 12 hours. Leukopenia, thrombocytopenia: both of these conditions are reversible in 1 to 2 weeks. Lesser found effects: alopecia, skin rash, gastrointestinal distress, myelosuppression, phototoxicity, and flu-like condition where the fever can rise up to 39 degrees Celsius. Myalgia and malaria can also be observed. CNS toxicity: hepatic toxicity, which is significant liver or renal function test abnormalities can be seen. Erythematous and utricranial rashes have been observed. Infrequently, anaphylaxis can occur following the administration of dacarbazine. Toxicity: there is no known antidote of dacarbazine overdose. Acute toxicity causes nausea, vomiting, whereas chronic toxicity causes alopecia, hemorrhagic cysts, and myelosuppression. Long-term therapy can cause cumulative bone marrow toxicity. Possible bone marrow suppression requires careful monitoring of WBCs, RBCs, platelet level. Hematopoietic toxicity can cause temporary suspension, cessation of the therapy. Precautions: if the symptoms of liver or kidney functional disorders or symptoms of a hypersensitivity reactions are observed, immediately cessate the therapy. Extravasation of medicinal products during IV administration may cause severe tissue damage and pain. Hepatotoxic medication and alcohol should be avoided during chemotherapy. Interactions: increased metabolism when used with enzyme inducers. Examples are barbiturates, rifampicins, phenobarbiturates, which act with cytochrome P450, phenytoin. Many potentiate the effect of mercaptopurine, azithromycin, allopurinol may impair immune response to vaccines. It may increase the effect of methoxylane due to photosensitization. Minor interaction with vitamin A and vitamin E. It also causes phosphatidine, and dacarbazine should not be used concomitantly. They can cause acute pulmonary toxicity. Food interaction: take on an empty stomach. Fasting for 4 to 6 hours before treatment may reduce nausea and vomiting caused by dacarbazine. Case study: classic Hodgkin lymphoma in pelvis treated by ABVD regimen. Hodgkin's lymphoma. Hodgkin lymphoma is a kind of lymphatic cancer that is characterized by the presence of Hodgkin's and Reed-Sternberg HRS cells in the lymph nodes. Classic Hodgkin lymphoma is a major type of Hodgkin's lymphoma, makes up to 95% of all kinds of Hodgkin lymphoma cases. Hodgkin lymphoma that originates from specific type of white blood cells called lymphocytes. Symptoms may include fever, night sweats, weight loss, non-painful enlarged lymph nodes in the neck, under the arms, or in the groin area. Hodgkin's lymphoma is one of the two common types of cancers of the lymphatic system. The other type of non-Hodgkin lymphoma, which is more common. To diagnose Hodgkin lymphoma, doctor will perform a physical exam and ask you about your medical history, proposing some tests to be performed. Imaging tests such as X-rays, CT scan, lymph node biopsy, complete blood count, immunophenotyping, lung function test, and an echocardiogram and bone marrow biopsy involves the tests which can be performed for the diagnosis of Hodgkin's lymphoma. The case study: a 20-year-old woman was admitted with a 2-month of left hip pain. Patient had drenching night sweats, low-grade fever, pubic rashes on the body, and an average of 15% weight loss during the past 3 months. She found an enlarged mass in her left hip during the latest month. She did not report any previous surgical history, and her total blood standard blood test has been taken, and her Epstein-Barr virus test has been taken. Bone marrow aspiration test has been taken. Her her CT scan, X-ray, MRI reports have also been taken. An open biopsy was performed, which showed that histopathologically was consistent with the diagnosis of classic Hodgkin lymphoma in her pelvis. Subject: onset is from 2 to 3 months. Location is left hip. Chief complaint: from 2 months pain in the left hip, drenching night sweats, low grade fever, pubic rashes on the body, 15% weight loss during past 3 months, an enlarged mass in her left hip may observe during the last month. Medical history: no previous surgical history. Current medication: not taking any medication currently. Soap notes. The object: age of patient is 20 years. She is a female. BMI is not known, but it is known that she has lost 15% weight during the past 3 months. Her temperature: she's having a slight fever. She's having a normal blood pressure and a normal heart rate. Epstein-Barr test shows a negative result. Pelvic X-ray test of left hemipelvis has an osteolytic erosion. MRI, T1 and T2 weighing spin echo images show higher signals and relatively long signal respectively in her left pelvis. CT imaging: lytic lesions spreading from left ilium acetabulum to the scleroiliac joint and finally reaching out the left sacrum. Open biopsy shows the histopathology was consistent with the diagnosis of classic Hodgkin lymphoma in pelvis. Lab tests: her standard blood tests were taken. Her WBC count was above the normal range. Her neutrophil rate was also above the normal range. Lymphocytic rate is below the normal rate. Her HbG is in the normal range, is below the normal range. Her platelet count are above the normal range, and her prognostic factors according to IPS guidelines are relatively higher. Assessment: from the symptoms and lab results, assessment made for the above patient condition are as follows. Imaging studies by pelvis X-ray, MRI, CT scan revealed osteolytic destruction of the left hemipelvic with a huge soft tissue mass. Open biopsy suggested that the open biopsy suggests pathological diagnosis of classic Hodgkin's lymphoma. Plan. After discussing with the physicians and assessing the patient's general condition, relatively higher IPS level, high risk of pathological fractures, sciatic nerve compression symptoms, and a treatment protocol of limb salvage surgery using an en bloc resection followed by a modular hemipelvic prosthetic reconstruction and a 6-cycle of ABVD regimen course of chemotherapy with 2 cycles before the surgery was performed for the patient. The patient was given an ABVD regimen with the following doses. The doses are repeated on day 1 and day 15. What was the surgical procedure? After 2 cycles of ABVD chemotherapy, the limb surgery was performed and patient got in the relatively good condition. A lower abdominal aortic balloon occlusion was used during the resection procedure to achieve clear margins. Type 1, 2, 4 left pelvic resections and total hip arthroplasty were performed. During the operation, a soft tissue mass was visualized, which was removed. A modular hemipelvic replacement system was implanted to reconstruct the left hemipelvis. The patient followed up another 4 cycles of chemotherapy with ABVD regimen 1 month after the surgery. Patient follow-up visits occurred frequently at 1, 2, 3, 6, 9, and 12th month after discharge, and after that every 6 months patient used to visit. The surgery and the ABVD regimen showed that the patient was easily able to move her limbs and her pelvic muscles. Pelvic movements were comparatively easier, and there was a better result the cancer was the follow-up treatments and the follow-up suggest that the cancer was also removed from her body after the ABVD regimen treatment. Following shows the reference of the case study. Thank you.